Hemorrhoids treatment. Medicines are number 1. Your doctor may give over-the-counter treatments, such as lotions, ointments, or suppositories, if your hemorrhoids are simply making you uncomfortable. These drugs contain chemicals that briefly reduce pain and itching, such as hydrocortisone, and lidocaine. If you use an over-the-counter steroid cream for more than a week without consulting your doctor, you risk weakening the skin in the affected area. 2. Complete eradication. If an external hemorrhoid has caused painful clotting, your doctor will most likely remove the clot by performing a thrombectomy, which involves making an incision to drain the clot. If applied within 72 hours of the clot forming in the location, this procedure is highly effective. 3. Take simple steps. If you have bleeding and pain from your hemorrhoids, your doctor may recommend one of the following minimally invasive procedures, which can be performed in the doctor's office without the need for anesthesia. Using a rubber band to treat hemorrhoids. 1 or 2 rubber bands are placed around the base of the internal hemorrhoid to restrict blood from going to the hemorrhoid, causing it to fall out within 1 week. Bleeding may occur 2 to 4 days following the operation, but it is rarely severe. Sclerotherapy, sclerosing. The doctor injects a chemical solution into the hemorrhoid tissue to shrink it, and while this injection is painless, it may be less effective than a rubber band. Coagulation therapy for hemorrhoids. Lasers, heat, or infrared radiation are used in coagulation procedures to cause the internal hemorrhoid to harden and then wilt. When opposed to rubber band treatment, this approach has some negative effects and the risk of hemorrhoid recurrence is higher. 4. Surgical procedures. If the prior therapies have failed and the hemorrhoid is significant, the doctor may recommend that you undergo one of the possible surgeries, which include hemorrhoidectomy, removal of the hemorrhoids. The surgeon eliminates the extra tissue that causes bleeding during this procedure. Local anesthetic with sedation may be used by the surgeon. This is the most effective method for entirely treating hemorrhoids. It is possible that the operation will make it difficult to completely empty the bladder, as well as induce infections in the urinary tract. Hemorrhoids are reduced in size. This procedure is exclusively utilized in the case of internal hemorrhoids and tries to block blood flow to the hemorrhoidal tissue. This operation causes less pain than the last one, but sadly, the odds of developing hemorrhoids again are higher. Bleeding, discomfort, and urine retention are all possible side effects of the procedure. 5. Hemorrhoid cure at home. Hemorrhoids that are not accompanied by a lot of pain can be treated at home, and these procedures include the following. Increase your fiber intake by eating more fruits, vegetables, and whole grains to soften your stools. Warm baths, 3 to 4 times a day. Take a hot bath for 10 to 15 minutes. Keeping the anal area clean. Always use warm water to clean the anal area and its environs, and make sure to dry it well. Instead of using dry toilet paper, use moist toilet paper that is free of alcohol and scent. Using a cold source to minimize swelling, apply it on the area where the hemorrhoid appears to be. Other therapies for hemorrhoids, depending on the type of hemorrhoids. Depending on the type of hemorrhoids, the doctor may treat them in one of the following ways. 1. Treatment for external hemorrhoids. Except in the case of thrombosis, there is no need or prescription for invasive procedures, invasive, or surgical operations for patients suffering with external hemorrhoids. The blood is frequently evacuated by a minor surgical operation, such as an opening, in individuals who are assessed within 72 hours of the thrombus occurring, to greatly improve discomfort. On the other hand, some doctors and experts in this field believe that removing the hemorrhoids surgically is preferable to preventing the thrombosis from returning. 2. Internal hemorrhoids surgical therapy. If various treatments fail to treat the hemorrhoids or do not produce the desired outcomes, or if the hemorrhoids are large, your doctor will most likely recommend surgery. Some procedures can be performed as an outpatient procedure, while others necessitate a one-night stay in the hospital, such as hemorrhoidectomy with a closed incision, hemorrhoidectomy using an open incision, stapling hemorrhoidectomy, Doppler ultrasound guided closure of the hemorrhoidal artery, and internal sphincterotomy on the side. Hemorrhoids are a type of hemorrhoids that are caused by. The easiest approach to avoid this is to ensure that your stools are soft and pass easily. It is preferable to follow the following steps in order to prevent or treat hemorrhoid symptoms. Consume dietary fiber-rich meals. Drink plenty of water. Contemplating the consumption of dietary fiber as a food additive. Avoid putting in a strong effort. Using the restroom as soon as you sense the urge. Participating in sports. Avoid standing or sitting for extended periods of time. Therapies that are not conventional. Herbs cannot be used to treat hemorrhoids, although certain plants and other natural substances can help alleviate hemorrhoid symptoms, the most common of which are honey. Coconut oil is a good option. Gel made from cactus. Vinegar made from apple cider. Tea tree oil is a natural antiseptic.